Caguan, one of the most remote areas of Colombia. After nearly half a century of conflict, communities have become isolated, cut off from basic services. The lack of healthcare here, as in other war-torn areas of the country, is causing great suffering.
I'm very worried about the health of my son. We really need a doctor here, so he can see us regularly.
The most precious thing we have is our baby boy. If he gets sick, we have to manage as best we can.
For decades, this part of southern Colombia has been the scene of long drawn-out conflict. The people here desperately need peace and the return of security and state investment. For 400 kilometres from the town of Cartagena del Chaira to El Guamo, there are just 2 small health posts for emergencies and medical evacuations. There are no roads here. The river is the main line of communication between the scattered communities.
There is still a long-lasting conflict here, and doctors are afraid to come and work here. Also, nurses are afraid to come and work here.
Every 4 months, mobile health clinics organised by the International Committee of the Red Cross take healthcare out to the communities along the river. It's a stopgap measure until the conflict is resolved and security returns to this remote tributary of the Amazon. It's late afternoon when the team of 2 doctors, 4 nurses and a dentist arrive in Santo Domingo. They set up their clinic in an abandoned building. Dr. Ortiz is a regular member of the ICRC team, bringing medical care to a community who haven't seen a doctor in months. Underage pregnancy is a serious problem. This 15-year-old gets her first prenatal checkup.
The problem is that pregnant girls don't have access to medical help, putting the lives of the mother and baby at risk.
Hundreds of patients queue for treatment. This man has a painful and potentially deadly scorpion bite.
I am very lucky to get treatment. Otherwise, I would have to use home remedies, such as caterpillar juice, which we use as a cure for snake bites.
The team's on a tight schedule. After 2 12-hour days, it's time to pack up and move on. The next stop is a 4-hour river journey downstream to the village of Montserrat. Once again, every item, from the generators to the drugs and medicine, has to be unloaded and carried by hand up the riverbank. An old health post abandoned years ago turns into a makeshift clinic. In its heyday, Montserrat was a thriving river port, exporting coca leaves back to the city. Today, cut off by the lack of security, it's just a few tumble-down shacks. Out of sight and out of mind, the people here feel abandoned and neglected.
For us health workers, the situation in this conflict-ridden zone is very sad. It concerns us that in many cases the illnesses could have been prevented. They could have been treated if they'd been discovered in time. These illnesses end up in sad scenarios such as death or serious disability, which could have been prevented.
Conditions which should be minor rapidly become serious if left untreated.
My little boy has spots on his tongue, diarrhea, flu, and he's coughing a lot.
Liu makes a living as a fisherman. He's got stomach pain and he's worried he's got something serious. Most patients here can't afford to buy medicines. There's no charge for the antibiotics Liu is given, but he's still worried how he'd cope in an emergency.
If we call the emergency services, it costs us $200 to $300, or else we have to walk for 4 hours to the nearest medical post.
Liu couldn't earn that kind of money selling his catch along the riverbank. As a neutral organisation, the ICRC is accepted and trusted by both sides in this long-running conflict. It's this acceptance that enables health teams to reach thousands of patients along the river. Only when security improves here will state health workers come back. Meantime, the villagers along the upper reaches of the Rio Caguan will have to manage as best they can.